first. We got a couple of things to cover in this video. There are three pigments that will contribute to skin color, but the only one that's made in the skin is called melanin. It's made from the amino acids tyrosine using an enzyme called tyrosinase. It's packaged into melanosomes that are sent to shield the DNA of keratinocytes from damaging ultraviolet light. The more sun, the more you need that protective shield, so the more melanin will be produced. And that's what we typically call a tan. There are a couple of different forms of melanin out there. One is a little more reddish yellow, the other is brownish black. And skin color differences are often due to the amount and form of melanin that an individual has. Freckles and pigmented moles are local accumulations of melanin. Excessive sun exposure does damage the skin. The elastic fibers clump, causing the skin to become leathery. That can also have an effect on your immune system and cause alterations in the DNA, and alterations in the DNA always give you the chance for cancer. Ultraviolet light destroys folic acid. Folic acid is necessary for DNA synthesis, so an insufficient folic acid amount is especially dangerous for developing embryos. So mothers take folic acid supplements. Photosensitivity is an increased reaction to the sun. There are some drugs that can do this, a few antibiotics, some antihistamines, and perfumes can cause photosensitivity, leading to skin rashes. The other pigments are keratin, which is a yellow to orange pigment. It's most obvious in the palms and soles. It accumulates in the stratum corneum and the hypodermis. It can be converted to vitamin A, which is important for our vision and epidermal health. And then the other pigment is hemoglobin, which gives a pinkish hue to fair skin because there are lower levels of melanin. So skins of Caucasians tends to be more transparent, so the color of hemoglobin shows through. There are some homeostatic imbalances that you should be aware of. Names for them: cyanosis is a blue skin color. It's typically a low level of oxygen or hemoglobin in the blood. Pallor, or blanching, or pale color, it could be due to anemia, it could be due to low blood pressure, it can also be a side effect of an emotional response such as fear or anger. Erythemia, or redness, could be caused by a fever, high blood pressure, hypertension, inflammation, or allergies. And when you see a yellow cast or jaundice, that typically indicates a liver problem. Alterations in the skin color could be due to bruises, which are black and blue marks. They are also referred to as ecchymoses or hematomas. They are the result of clotted blood just beneath the skin. As the clot is broken down, the bruise will change color. Brown or black necklace or bruises are hyperpigmented dark areas in the axillae around the neck, and they could be a sign of insulin resistance and elevated blood glucose levels. Hair consists of dead keratinized cells. There is no hair located on the palms of your feet, the palms of your hands, the soles of your feet, your lips, nipples, or portions of the external genitalia. That hair functions to warn us of insects. On our head, it guards against physical trauma, also protects us from heat loss, and it helps to shield the skin from sunlight. Hairs, also called pili, are flexible strands of dead keratinized cells. They're produced by the hair follicles. They contain a hard keratin, not like the soft keratin found in skin. And hard keratin is tougher, more durable, and cells do not flake off that contain hard keratin. We can divide the hairs into the shaft, the area that goes above the scalp where keratinization is complete, the root, the area within the scalp where keratination is still going on. That shaft itself is divided into three regions: a central core called the medulla, which has larger cells and air spaces; the cortex, which are several layers of flattened cells surrounding the medulla; And the cuticle is the outer layer that consists of the overlapping layers of single cells. A hair pigment is also made by melanin, melanocytes in the hair follicles. There are combinations of different melanins available here. You can get yellow, rust, brown, or black, and that gives us all our possible natural hair colors. However, there's one more additional called pheomelanin pigment, which only those of you with red hair would be able to make. Gray or white hair usually results when melanin production decreases and air bubbles begin to replace the melanin in the shaft. The hair follicle extends from the epidermis surface to the dermis. The hair bulb is the expanded area at the deep end of the follicle. The hair follicle receptor, or root hair plexus, is a sensory nerve that wraps around the hair bulb. That makes hair our sensory touch receptor, and this is where hair comes into play at detecting insects on our body. The wall of the follicle is composed of a peripheral connective tissue sheath, which is derived from the dermis, and it's also called the fibrous sheath. It has a glassy membrane of thickened basal lamina, and an epithelial root sheath, which is derived from the epidermis. The hair matrix is the actively dividing area of the bulb where new hair cells are produced. As the matrix makes new cells, it pushes the older ones upward, very reminiscent of what happened in the layers of the epidermis. There is a small band of smooth muscle attached to the follicle called the erector pili, and when those contract, that's what we get when we get goosebumps. The hair papillae is the dermal tissue containing a knot of capillaries, and that knot of capillaries are going to supply the nutrients and remove the waste necessary for growing hair. All of that's shown here. There are a number of different kinds of hair on the human body. Vellus hair is a pale, fine body hair that children and adult females have. Terminal hair is our coarse, long hair that we find on our scalp and our eyebrows. At puberty, this same hair appears in the axillary and pubic regions of both sexes, and also on the face and neck of males. Nutrition and hormones can affect the growth of hair, and follicles cycle between active and regressive phase. They average about 2.25 millimeters of growth per week, and we typically lose on average 90 scalp hairs a day. In women, ovaries and adrenal glands produce small amounts of androgens, the male sex hormones, mostly testosterone, but tumors in these organs could cause an abnormally large amount of those androgens, giving you polycystic ovary disease, and that can result in excessive hairiness, which is termed hirsutism, and other signs of masculinization. In many cases, though, there are no clinical problems found. Alopecia is hair thinning. It occurs in both sexes after age 40. True baldness or frank baldness is genetically determined and sex influenced. So if you have the right genes and you have the right hormones around, you get, in this case, male pattern baldness, which causes a response by testosterone to the follicles to give you that bald pattern. Telogen effluvium, TE, is an abrupt hair thinning caused by an abundance of hair follicles entering a resting state phase at the same time. And that has been reported to be caused by stress-induced factors, hormonal changes, surgery, emotional trauma, or crash dieting. Other things that can cause hair thinning or changes in its texture include drugs, hypothyroidism, and protein-deficient diets. Your nails are scale-like modifications of the epidermis that contain hard keratin. They act as a protective cover for distal, dorsal surfaces of the fingers and toes, consisting of a free edge, a nail plate, and a root. The nail bed is the epidermis underneath the keratinized nail plate, while the nail matrix is the thickened portion of the bed, which is responsible for the growth of the nail. The nail folds are skin folds that overlap and border the nail. The epiconium is the nail fold that projects onto the surface of the nail body. more typically referred to as the cuticle. The hyponercurium is the area under the free edge of the plate that accumulates dirt. Nails normally appear pink because of underlying capillaries. The lunae is the thickened nail matrix, which typically appears white. And it should be noted that abnormal colors and shapes can be indicators of several different disorders in humans. Nail appearance can help in distinguishing things like a yellow tinge may indicate respiratory or thyroid gland disorder. Thickened yellow nails can be due to a fungal infection of the nail. Colochina or spoon nail is an outward concavity of the nail that could be iron deficiency. And bow lines are horizontal lines across the nail that indicate severe illnesses such as uncontrolled diabetes, heart attack, or cancer chemotherapy. Okay, we're going to stop there.